100.9 The Creek, the sound and soul of Central Georgia. That was Miles Miller with Solid Gold here on The Creek. Charles Davis, Sam Stevens, and we have our friends from Houston Healthcare this morning. Sam, would you introduce our guest for today?
Yes, we would love to welcome to the broadcast Dr. Williams.
Dr. Williams!
Yes! Hey!
Good morning, sir. How are you?
Great. That's the best introduction I've ever had.
Well, look, I mean, they ought to give you better introductions wherever you go then.
We thought about throwing you a parade.
I almost did.
But
I got streamers in the car, but
couldn't get it together.
Just didn't want to do it. You are an ENT with Houston Healthcare. So we thank you so much for being here this morning because especially during this season here, we have tons of questions. Sam, how do we want to start this morning?
Well, first of all, I want to let Dr. Williams share with the listening audience a little bit about himself and his career and his life journey, because I learned something truly fascinating about you. You were a flight surgeon in the U.S. Air Force for an F-16 squadron. No big deal.
So, number one, thank you for your service.
I appreciate that.
Number two, that's a cool job.
Yes, it is.
What was that like?
Well, it was a real dream come true for me, really.
Yeah.
I grew up thinking I wanted to be a fighter pilot, an airline pilot.
Okay.
Got involved in a rescue squad, and that's when I realized my real calling was into medicine.
Was in medicine, yeah.
Went through college knowing I wanted to go to medical school and spent a lot of time studying, lots of competition for the medical school positions, the entrance. Ended up in medical school focusing on just what I wanted to do. And every rotation I did, I loved. And thought, well, gosh, I want to be a cardiologist. No, I want to be a GI doctor.
Yeah, okay.
Well, this operating room's pretty cool.
Yeah.
The Air Force paid for medical school for me, so I owed them some active duty time afterwards.
Makes sense, yeah.
So for me, getting to combine medicine with aviation was just unbelievable.
Yeah, that was the thing. That was F-16. Good gracious. Those are some intense gentlemen.
Tell Charles what you told me off the air about your dream day that you said was the turning point for you.
It really was. And one morning I had a surgery scheduled in the operating room. Everything went great. That afternoon I show up for some training flights, and I'm in an F-16 that afternoon, doing some basic combat maneuvers, thinking I was in the operating room in the morning, I'm in an F-16 in the afternoon. How can it get better than this?
I said you were like, is this my life right now?
All I can see right now is with you in the F-16, the theme song from Top Gun playing, and you're just...
I went to the danger zone.
Wow. That is intense.
Well, I had to remind the students, as a flight surgeon, a big part of what I did was take care of the squadron and their families.
Yeah.
And we had students that would come through at one of the bases I was stationed at.
Yeah.
And a lot of that was actually T-38 flying. But they would talk about Top Gun. I said, guys, that was Navy. We're Air Force.
Doesn't matter. I don't care. Look, I'm a military brat. Top Gun is applicable to all the services. So we're good.
You're right. It really is.
So you were talking about how you loved every single one of your residencies.
Yes.
You kind of were like, well, could it be this? Could it be that? But what made you settle on ENT work as a specialty?
Yeah, well, my first rotation as a third-year med student was in surgery.
Okay.
And it was overwhelming, honestly. Then through the different medical subspecialties and ended up in OBGYN back in the operating room. And that's when I realized that I wanted to do something in the operating room, but I wanted diversity. And ENT allows me to take care of children, and I'm taking care of seniors. I'm working on medical decision-making as opposed to just operating.
Yeah.
So there's the medical side of it. At one point, it's microsurgery. The next operation can be a large neck mass. So the diversity. And in medical school, I'll never forget when one of our professors said, okay, we're going to do head and neck anatomy. That's going to be the hardest anatomy you're going to learn. Like, well, okay, bring it on.
Let's go there.
You were ready.
Say less.
Yeah. I remember the first time I, was referred to an endocrinologist for some medical issues I was having. I asked her what made you choose endocrinology, and she said, I knew I would never be bored. I would never
right.
stop learning. Like
There's always something.
It would always be something. So it sounds like that was kind of your MO as well. I want to be constantly challenged.
Exactly. Just the diversity. And ENT is a very procedure-oriented specialty. And again, a lot of office procedures and a lot of complex type of surgical procedures. And the new technology that keeps coming out, and I got to hand it to Houston, that they have been very supportive in providing me with state-of-the-art equipment, to be able to do these complex sinus surgeries.
Of course.
Head and neck surgeries, microscopic ear surgery, and the like.
That is incredible. Microscopic ear surgery.
You picked up on the same thing that
I looked at Charles and I was like, he and I are both like, tell us more.
I would love to know more about that.
Yeah, what's an example? Like, give us an example of something.
Well, a common procedure on the ear is repairing a hole in an eardrum. Somebody keeps getting infections because the middle ear space is exposed, or it's affecting their hearing. And it really gets kind of comical sometimes with my scrub. I tell her I need a little cotton ball to put on the corner of the inside ear canal. And she gives me a tiny little cotton ball and said, this won't even fit through my little speculum.
Get
smaller.
Tiny.
I don't think you understood what I said.
Millimeters.
A flea, like a cotton ball for a flea.
Yeah.
Think that. Yeah.
That's it.
Oh my gosh.
Me and Sam had talked about this before you came on as well. All the work that Houston Healthcare does, which is absolutely amazing, the way y'all serve the community that you're in. But being in Georgia, we are like a very huge ecosystem for everything. Hot, cold, it fluctuates. So
by the hour.
By the hour, yeah.
Yeah.
So like when it comes to certain things, I know a lot of people suffer from ear infections and sinus infections in this area. Are there ways to kind of combat that and try to eliminate some of the possibilities of getting those things?
Letting it get to that point.
Yeah.
Well, if just kind of reduce it to the simple terms. Sinuses are air spaces in the bone. The middle ear is an air space behind the eardrum. And any time a space like that in the body gets blocked up, it can get infected, and probably will. It needs to be able to ventilate and drain.
Makes sense.
So if you're getting lots of congestion for some reason, if there's a way to prevent that congestion, you can prevent the infection. If it's allergies, then there's some great allergy medications, over the counter, the intranasal steroids like Flonase. The antihistamines are great now, like Claritin, Allegra, Zyrtec, that don't put you to sleep like the older ones. Like Benadryl or Trimaton. They'd dry you out, they'd work, but you'd wake up a day later.
Yeah, true, yeah.
Which sometimes can be absolutely fantastic if it's a terrible sinus infection.
Yeah.
But, we got to go about our daily lives.
Right.
And the thing I've learned being a grown-up is you got to go to work, boo-boo.
Yeah.
I'm sorry that your ear hurts a little bit. Yeah. So when it comes to, all right, we're in a full-blown sinus infection mode, there was a question I wanted to ask you because I have suffered from them pretty chronically over the years. And like we were saying off the air, Charles and I are both singers.
Yeah.
And the one thing you cannot do is lose your resonator. And for everybody in Radioland, I'm touching my cheeks and the bridge of my nose, right? Are antibiotics the only way to get rid of a sinus infection? I feel like I've been to the doctor a couple of times when I suspected I had one, and they were like, let's just do a flush and a rinse and try to avoid getting on an antibiotic. What's the perspective on that?
Well, again, the idea of reestablishing the drainage and ventilation, and salt water can do that wonderfully.
Okay.
It also gets rid of the contaminants, the pollen and everything that can be triggering more swelling or congestion, or even get rid of any purulence, any bacteria. So that is a way, of treating a sinus infection without necessarily using antibiotics.
Okay.
So it is possible.
Because real talk. So are you saying? And I'm just asking your professional opinion on this. You see advertised all the time. The machines that you can use to clear out your nasal passages that use the suction in the water.
Are they safe?
Is that something that you could buy to avoid having to come see you in a situation like that?
Not that we don't want to come see you.
No,
but you know what we're
I
saying.
understand. I definitely want people to stay well. If it's a viral infection, you're going to get a cold when it's cold season. If you're around people, it's
going to happen.
Inevitable. And an antibiotic's not going to help if it's a virus.
It's important to remember, everybody.
That makes a lot of sense.
Don't get mad when he won't give you a Z-Pack because it's viral,
it's not going to do anything for that.
Very big point, exactly. But the saline irrigations really do work.
Okay.
And around allergy season, you think about it, especially if you've been outside, dusty, dirty, pollen field or something, getting all that washed out can prevent it going into something more serious.
So those, like, what do they call them? Are they nasal lavage?
I've heard like neti pots. I've heard like all different types.
Those
of
are,
names for it.
you would recommend using those?
Yes.
Yeah,
okay, that's great.
Yeah, if as long as it's not a viral situation, that's a whole other thing you need to take care of. But for just like clearing it out and saline, that's good there.
We were also talking about sinus surgery a little bit before you you came on with us, and I feel like sinus surgery is a big boogie monster. You see what I did there? Pun intended. I'm ringing the bell for myself. A lot of people are really scared of it. You hear a lot of horror stories from people, but sometimes it is what needs to happen to help a person get well and heal and have better quality of life. What are the biggest misconceptions about sinus surgeries that scare people? Let's debunk some myths here.
Well, sinus infections are not uncommon, and if you get one or two and they respond to antibiotics, then that's adequate treatment, and that doesn't require a specialist or anything. But if you're continuing with infection and symptoms that go on for months, antibiotic after antibiotic, you're still not getting better, or you're clearing and problems are coming back.
Yes.
Most of the time it's an anatomical problem where the sinus openings are just too small. So that obstruction, instead of just narrowing, you get blockage. And like we talked about, blockage leads to infection. So the surgery is aimed at relieving that obstruction.
Okay.
The older surgeries and the older understanding was the sinus had to be widely opened, the lining had to be stripped out so new healthy lining could grow in. Exactly. Those surgeries were miserable. But the new understanding and research has shown that if you reestablish a natural size opening, which is not hard to do, minimal surgery, then everything reverses, heals itself, and then you don't keep getting the infections. So now instead of using chisels and mallets, which literally...
Lord have mercy.
Ooh, I'm going to hold my face.
Oh, and I feel fortunate because when I started my training, that's what we did, and it was brutal surgery. And there's still some people doing that kinds of old-style operations.
And that's where the horror stories come from, probably. Because that recovery's got to be awful.
Horrible, yeah.
And you'd have to put yards of packing in someone's nose to control the bleeding after that kind of surgery, where now, none of that. I use a dissolvable kind of material that turns into a gel, so there's no packing to remove. I use a balloon to open the sinus passage, or a little precise shaver. Where I'm going with my endoscopic instruments, high definition cameras, right to the specific location. And in some cases, I can even do it as an office procedure.
Wow.
Yeah, so it's come night and day from what sinus surgery used to be.
Is that the balloon plasty thing?
Yeah, exactly.
That was
balloon
actually
sinuplasty.
That was recommended for me. And I didn't do it because I was scared.
Yeah, no, that makes sense.
I mean, my thought, and you will appreciate this too, Charles, I'm like, what if it changes my voice?
Yeah.
What if it changes my singing voice?
As singers, I think that's a big part of it too. We are so connected with our identity being that anything that's going to affect that is terrifying to us.
Sure.
But from the way, Dr. Williams, the way you explained it, I feel very calm about it now.
Yeah, right.
It made me go, okay, well, maybe I should need to see, because you said something very important about taking the antibiotics and it getting to that point and then it come rearing back. That's how it was with me with some ear infection stuff that I had last year, where it was I would take the antibiotics, I would take the steroid, and it would get better and I would feel it get to a point. But as soon as the antibiotic wore off, it came jumping back. So, like I said, that's something we talked about it before. It's like if you have a sore throat, go see your family practitioner. But if you got 7 days in a row, something like that, then maybe you need to go see you or like that. That feels like the same thing with like an ear infection as well. If you're constantly having it over and over again, that's when you really need to check into a specialist and get that looked at.
Well, looking at why that is happening and then trying to fix the underlying problem as opposed to just treating each event as it occurs. That's where we as specialists can step in to break that pattern. And it's I think it's important for the physician to spend time talking to the patient, understanding, number one, what their problems are. And then get at the cause. So you can, that's one thing, again, I love about ENT. We not only treat the problem, but we fix it. A lot of disease states you can just maintain and control, like a diabetic.
It's a treat, not fix.
I like the idea of being able to, solve the problem.
That's so great. Really quickly, I wanted to ask you, what is the most common issue you see and treat in the practice around our community?
Well, there's really in two realms. First are the children. They all, with recurring ear infections, we're putting ear tubes in. Or, sleep issues where tonsils are so big that they're causing blockage. So we're doing a lot of ear tubes, tonsillectomy, adenoidectomy.
Okay.
On adults, it's primarily septoplasties and sinus surgery. And sinus surgery has become much less invasive, so people are much more willing. And I'm going to be quicker to recommend a surgery that is going to have the results we want, without having to go through, lots of pain and recovery.
Yeah.
You want to kind of balance that risk and reward, so to speak. With all of that. But, sinuses, no question. Like we said earlier, this region is just fraught with, just the climate.
Exactly. It's the climate that we live in. It can have all these different effects. Well, no. Go ahead, baby.
I was going to say, where can people reach you, Dr. Williams? Like, this is fantastic.
Well, the Houston Hospital website has the contact information, which is very, very well done.
And for a specialist, do people need a recommendation from a primary care to come see you?
Well, we are referral based.
Referral based, yes.
Okay. And the idea is that once a primary care doctor or mid-level has done everything they can and they feel like, we've kind of hit the ceiling here, that's the patients we want to see. And we've gotten very busy, as you can imagine.
Yeah.
Had a partner join me earlier this year, and he has been wonderful. Dr. Zhang.
Yes.
He's outstanding.
Yeah.
But by limiting it to referrals, then we're able to get to the more complicated.
And you can focus.
Yeah.
And anybody that has a question, is this cancer or is this somebody that's been hoarse for a month or something? They need to have their vocal cords looked at. What's going on?
Which is always good for singers as well to have them. I get scoped usually once a year.
I have never done that. So now
you need to get scoped.
The things that you're talking about, it's like, okay, this is stuff I really need to do and get looked at. And this has been
and when you talk about things like the scope, again, that will scare patients. But spend time, show them what I've got and what we're doing. And
y'all, it's good. You're good, y'all. It's the teeny tiniest little camera.
Exactly.
I was terrified at first too, and then I was like,
yeah, you
and
see
he
the
was
look.
like, "Yep, that's all you got to do." I'm like, "Wow, this is amazing."
Like, you see the look on my face while you're talking about this. I'm like, Sam, if you tell me this is okay, I'll talk to Dr. Williams off the air and schedule this thing now.
It's okay. Not only is it okay, it is such a relief when the doc comes back and says it's just pardon the yucky, y'all. It's just mucus. There are no nodules. I'm like, I
love that.
Because you don't want nodules on your vocal cords if you're a singer who talks for a living.
Yeah, literally. Yeah. God, the more you said it, the more I know I need to
need to go. Hey, a 2 for 1, Doc? 2 for 1.
No, we're not doing this.
We're doing 2 for 1.
We're not doing this today. First off, Dr. Williams, thank you so much for being here. You have been illuminating this morning, very seriously. And then for all the work that you do with Houston Healthcare to ensure that the community that you live in is living the healthiest lives that they can. Salutes go to you. Shouts out to you and everybody over at Houston Healthcare for what you all do.
Ring that bell.
Anytime you want to come back, Doc, please come back and talk to us. We would love to talk to you. And as we go to break, we'll talk about a man who probably does have a deviated septum and never looked at it. Here's Al Green to take me to the river.